Hello, everyone, and welcome to Ducks in a Row, Advanced Directives for Healthcare. Let's go ahead and get started. My name is Beverly. I'm the Communications Manager for People's Memorial Association, and I'd like to begin by doing a land acknowledgement. People's Memorial Association would like to acknowledge the traditional, ancestral, unceded territory of the Coast Salish, Duwamish, and Suquamish nations on which we work and live. As you may or may not know, People's Memorial has an office right here in Seattle, Washington, and most of our staff and volunteers are in the surrounding areas. Just a couple standard housekeeping items to begin with. I'm going to go ahead and have us all keep ourselves muted. It's going to help a little bit on cutting down on our barking dogs and our dishwasher sounds a little bit. And fear not, though, if you do get pulled away by a distraction, we're going to be recording. Oh, sorry, I forgot to update this slide. We are recording today's presentation, so you'll be able to review it if there's something that you'd like to return to. If any questions come up for you, please drop them in the chat box or use the Q&A feature. And if you're a little on the shy side, feel free to directly message me your question, and I'll go ahead and keep your identity secret. And if you haven't quite decided by the end of the presentation how to word your question, we've also planned for that as well. And we'll make sure you have our contact information so you can reach out to myself or to Bonnie directly, and we'll make sure that you don't have any questions bothering you. Bring the computer a little close. If this is your first time joining us, welcome. Maybe you don't know too much about us at People's Memorial, but I'm really pleased to give you a little bit of an overview on how we serve our community. We're the oldest and largest memorial society in the United States. We were founded in 1939 right here in Seattle. We're the only nonprofit in Washington that provides funeral education and advocacy services. But if you're joining us from a little further afield, fear not. There's about 60 affiliated organizations under the umbrella of the National Funeral Consumers Alliance. So there's very likely a similar organization a little bit closer to your own home who can provide you some similar services. To date, over 216,000 people have become members of People's Memorial. And of those folks, about 71,000 of them are currently living. So we stay very busy in the office. And when we think about how we serve all those folks, we've got a couple different facets of the organization. One of the biggest things is education. Classes just like this and resources hosted on our website and on our different social media accounts and our newsletters help us stay in touch with our members, make sure they have access to the information they need to make informed funeral choices and the necessary resources to communicate with their friends and family about what it is they want and what they need. We also are really proud of the advocacy work we do here. We support our state legislature in attempts to increase funeral options for Washingtonians, as well as increase price transparency in a notoriously opaque industry, the funeral industry. And we work really hard to protect the diversity of cultural death practices here in Washington. We have just a beautiful bevy of cultures and peoples with all kinds of different spiritual and emotional and social practices, and all of them are valid and deserve to be protected and honored in death. One of the biggest guiding principles that makes us all show up every day is a commitment to making sure everybody has access to affordable cremation, aquamation, burial, and natural organic reduction. And if you'd like a little bit of information about those individual items, please feel free to visit our website anytime and start your research process. Looks like I have a raised hand, just 1 second. It looks like someone named Adrian has raised their hand. Will you drop your concern into the chat box and I will be able to see what you're looking at. Okay. If you're thinking that some of these things sound like they might be pretty useful to you as you get your own wishes organized and down in writing and you work on communicating with your support system about it, you can become a member of PMA whenever you're ready. A lifetime membership is only $50 per person, and that's a one-time fee, and then you're stuck with us for the rest of your life. One of the biggest benefits that drives people to purchasing a membership is the discounted rates for those funeral options that I mentioned before. We have about 25 different funeral homes around the state of Washington that are contracted with us. And so we've pre-screened all of those businesses for you so that we can guarantee you're not going to receive any sales pressure, that sort of used car sales experience that a lot of us dread. We make sure that we've negotiated all of the price discounts up ahead of time. So you have the most possible information going into that experience as possible, which empowers you to only choose the things that you really want and need. In addition to those funeral homes, we have 4 contracted cemeteries. a monuments company, a pet funeral home. I believe we have a virtual memorial service as well. And kind of I would think it's kind of like a gem in our crown is our member-owned co-op funeral home right here in Seattle. It's a very unique business model. It's one of the only ones in the country. And all of the folks who are members of PMA share ownership of this funeral home right here in Seattle. And just in case you weren't aware, today's webinar is part of a series. You don't have to go to all three, but I would encourage you to maybe take a look and see if our session on Wednesday or Friday might be something that would be useful to you, or maybe share with someone else. Our session on Wednesday will focus on estate planning, and our session on Friday will teach you all about the different options that you have for your funeral. We're kind of going to focus on the things that you can do with your body. So if you've kind of heard there's a new sheriff in town with different green funeral options, I'd really encourage you to come on Friday to learn what those new options are and how you can get access to them. And saw a chat just come in. Before we even get started, though, I did want to thank you all for being here. It's community members like all of you that really make PMA what it is. You know, we wouldn't be here without folks to serve and people to help. That's what we're doing here. And all of our work is made possible by the support that we receive from folks like you. If it speaks to you, I would encourage you to visit peoplesmemorial.org and make a gift of any size to support the essential work that PMA does for Washingtonians. It's just, I always joke that this organization, you know, we've been around for 83 years and it's not big hefty donations that keep us going. It's an organization that's sort of built on the back from crumpled $5 bills from little church lady handbags. So every little dollar makes a huge difference for a Washington family. Now that we got that out of the way, let's get to the real reason you're here. I've got my friend back, Bonnie Bizzell from Honoring Choices, and she is going to just blow you away with breaking down advanced directives into some consumable chunks. And I'm sure you all already know how important it is, but I bet she's going to do some additional convincing to remind you how important this is. Welcome, Bonnie.
Thank you so much. I'm so excited to be here, and just bear with me as I get my bearings. I'm going to share my screen, and can you let me share my screen, please? But it's not like I've been set up to, you know, I don't like being on a pedestal. I very much like being on the earth. So what I want to tell everyone is that I have no doubt that many of you probably know a lot about advanced care planning and advanced directives as well. So I'm going to just make sure that we all have similar information and knowledge, and feel free to drop your questions in that chat box. Beverly has been a really good partner in crime with me in the past, and I know she will be again today. So let me get up my screen. Can you see it?
Looks good to me.
Excellent, excellent. Okay, so you're going to see a couple things. I will be not like this. Hopefully I will be like this and you'll be able to see me, but I do keep my notes in front of me because there's often a lot that I need to cover. Also, I want to acknowledge, just like People's Memorial, Honoring Choices Pacific Northwest, who I'm here representing, we sit in Seattle. Our office is also in Seattle. And so we also like to acknowledge that we are on the traditional land of the first people of Seattle, the DPOAHC people, past and present, and honor with gratitude the land itself and the DPOAHC tribe. And so wherever you're joining us from, we ask that you join with us in acknowledging and thanking Indigenous peoples for their ongoing stewardship. All right. So welcome to Advanced Care Planning and Advanced Directives. I don't know why I have an extra number in my date there, but it is August 23rd, 2021. And so today we're really going to talk about what advanced care planning is. We're going to talk about advanced directives, some of the main documents. And one of the first things I always like to start off with is congratulations, you are here. It's very impressive that you are here with us, present today. Woo! Especially in these times, in these really goofy times. And, you know, advanced care planning is always important. It's always been important. It's critically important now with the uncertainty of COVID-19, and we've seen this Delta variant coming through. It's one of the ways that you really can feel like you're taking control back, because it really is about your voice, your needs, your preferences, your values, and it helps you understand what in your life is important to you, so you could continue to have the life you want. And so what I like to remind everyone, planning is right there in there. Advanced care planning is just that. It is a plan. And, if you've ever done anything and you've had a plan, sometimes the plans have to change. But what it can do is if you plan now, if sort of what future medical decisions you might want, or even where you'd want to be, that helps people think about what's important to you and get you as close to that as they possibly can. They may not be able to get you 100% all the way. For example, if you have a condition and they really can't help you at home and you really want to be at home those last few days, that may not be possible, but people can make the area around you look more like your home. They can bring in that blanket. They can have those photos. So a plan is a plan. And sometimes a plan doesn't end up exactly what we want it to be. But without knowing where the destination is, we can't possibly try to get you there. And I think it's also important to remember that, providers, the doctors, the internists, the nurses, everyone wants to make sure that you get the care you want. They're not in the business to give you care that you don't want. So just know that is important to them as well. So what are we going to cover today? Well, I'm going to tell you who Honoring Choices Pacific Northwest is, because I think it's important that you know where this information is coming from. Then I'm going to dive into what is advanced care planning and why do we need to do it. We're going to not only talking about why it's important way down at the end of the road, but why it's also important even now, even today, even how it can help you right now. But we're going to look at the documents that we use, and I'm going to get to any questions that you have, hopefully. If not, you can always reach out to me. I will be your personal concierge when it comes to advanced care planning. All right. So who is Honoring Choices Pacific Northwest? Well, we are a joint initiative between the Washington State Hospital Association and the Washington State Medical Association. And why is that important for advanced care planning? Well, if you're at the end of life, the odds are you're going to have to deal with a doctor or a provider. That's the medical association. And you're probably at some point going to visit a hospital. That's the hospital association. So it's so tremendous that these two organizations came together to say, let's make a difference in this, because they both are going to be there. And our vision is that everyone will receive care that honors personal values and goals at the end of life. Everyone, personal values and goals. And so what we want to do is we really want to inspire people to have those conversations about the care that they prefer. So to the general public, how do we do that? We come to you, we give education. I do one-on-one consultations with people, facilitations. I do a lot of things. We build guides and information to help you understand what things mean. We have a website that has a lot of details that you can look up. So that's one thing we do. And then for healthcare and community organizations, we'll actually help them learn how to discuss, record, and honor end-of-life choices, if whatever is appropriate. So we'll train them on how to have those facilitated conversations and really be person-centered in that. We'll help them build their system, their workflow, whatever. We'll give presentations to them so they at least know what they're talking about. We do all of that. We are a philanthropic nonprofit. So that means that everything we do is free. We go out there and we do it for free because it's so important that people do this. And we have partners from large hospital systems to individual death doulas. We run the whole gamut of who we work with, because honestly, this is something that really does take a village. So today, well, in general, Honoring Choices Pacific Northwest, we have 3 goals for everyone who's 18 and older. We want people to talk about it, write it down, and share it around. People need to explore and ask questions about what's important to them and what decisions they may need to make. Ideally, we want people to write it down. That can be in a formal document, an advance directive that we're going to talk about in a bit, or it could be even more informally. There are a lot of people who may not want to do a legal document for a lot of different reasons, and that's okay. There are other ways to share what's important to you. For example, there was someone from the Hmong community who didn't want to do a legal document. He got one of those good job certificates. You can get them at like Office Depot, and it just says, and then you fill in everything. And it's a good job to all my healthcare providers. When my heart stops and you let me go, you have done a good job. That tells you everything you want to know. We've had people write detailed letters, beautiful letters to their loved ones about how important they are and what kind of role they could take at the end of life, whether it's being a healthcare agent, if they decide to also do a legal document, or just like, this is what's important to me. Susie, who's it? You're really good at making sure that everyone feels comfortable. So can you make sure that people are welcomed, and if they come to visit me, that they feel like they're appreciated? And can you also help me let them know when they're not welcome, like help me move them, limit their time. So we want people to write it down. And then last but never least is we want people to share it around. Share it around. It is so exciting that you get to share what's important to you with people who are important to you. I mean, we do that every day in little bits and pieces, but this is really important for advanced care planning as well. I have told my nosy neighbor down the street, because my nosy neighbor is going to ask a lot of questions. And if my nosy neighbor knows ahead of time, maybe there'll be fewer questions. And maybe that person won't bother those who are actively grieving quite as much. We want you to share it with people who matter to you, whoever that is, whether it's blood family or created family. Share it with your provider. If you have a primary care provider, great. If you go to the same kind of system all the time, like there's a hospital or you have a massage therapist, share it. Today, we're actually going to really just focus on the first 2 things, just so you know. All right. So before we dive deep, what I want you to do is reflect on this question. What brings you joy? And while you think about that, I'll tell you what brings me joy. And if you feel comfortable sharing, please do so in the chat, because I love it when people feel comfortable enough so that I can hear what brings people joy. I'm going to tell you something that brings me joy. I have a Jacoby, a rescue Jacoby. A Jacoby is part Jack Russell, part Beagle, all cute. And I love playing with him. I get out on all 4s. I growl with him. I don't actually take the toy in my teeth because it's gross, but I'll pretend that I'm chewing on it. And I just love rolling around and playing with him. So I would love to know if there's anything in the chat, or Beverly, do you want to share what brings you joy in your day-to-day life?
It's a great question. Yeah, don't be shy, y'all. Feel free to drop it in the chat. We love to kind of get a peek into your lives, since you get to see a peek into ours. Actually, before I say so, Bonnie, I've got to say, you always talk about this cute dog, but I've never seen a photo. Do you think maybe that needs to be incorporated into a future presentation?
I think I should definitely do something about that. So if you do a follow-up with everyone, I will send you a photo that you can send everyone.
Okay, I'm making a note, everybody.
He's really cute. And you can't tell me your dog's cuter, because my dog plays at my heartstrings. So.
Ooh, we've got some good ones in. So,
good.
Of course, love music and reading. It's art that sustains us.
Oh, yes.
Friends, dancing. Okay, someone says pigeons, and I love that.
I love that too. How unique that you love pigeons. That tells me that if I might, well, we'll get to how this informs how you how people might use it to make decisions for you. I love the music and the friends and what really just sort of resonates. What else? Do we have anything else?
I really like this one, walking in ancient forests.
Ooh, there's something so majestic about that, and mystic at the same time.
Oh, playing music with their band, cuddling with a partner. That's pretty lovely.
Yeah.
Oh
Yeah.
my gosh, someone has a cat named Thunderpaw.
Thunder, Thunderpaw.
I love this.
Oh, this is fantastic.
Natural waterways. I think mine lately, speaking of waterways, is I just moved into this apartment earlier this year that has this great water view. So I just like to sit and watch the sunset every day. With like an adult beverage and just like look out at the water and contemplate. That's like the best
sounds very just fabulous. That sounds fabulous.
I'm not the only one. Someone says trees along the streets of my neighborhood. It's your safe space, your home.
Yeah. These are all great things to know about what brings you joy. And I promise you, I will tie how what brings you joy actually fits in with advanced care planning. Because you've already started advanced care planning. Yeah. Just by answering what brings you joy, you've already started your advanced care planning or continued it if you'd had already started doing it. It is advanced care planning is about what brings you joy. It's about how you want to live. That's what it is. And it is a process. It is an ongoing process. So it will change, and that's okay. What's important to you yesterday? Remember 2019? 2019, I had a lot, not a lot different, but some different things that were important to me before what I call BP, before pandemic, or you can say BC, before COVID. So advanced care planning is a communication process. It's a process between individuals and their healthcare agents and those who are important to them, to understand, to reflect on, to discuss, and to plan those future healthcare decisions for a time when those individuals may not or cannot make those decisions on their own. And that's a key piece. Advanced care planning, advanced directives only happens if you can't guide your own care, if you can't direct your own care. So it's not a one and done. It's a lifelong process, just like learning. And expect it to change, and that's okay. And it's something to maybe revisit periodically. I like to do it on my birthday, like right around the birthday, just to make sure everything's aligned. But a lot of people say marriages or births, a divorce, sadly, other people's deaths, or even every decade, like I've just turned 50, now it's time, or I turned 60, or I turned 20. Those are all good times to review what's important to you and make sure that whatever you have written down aligns with that. So speaking about writing it down, so when you write it down, those are advanced directives. Advanced directives they're usually thought of as legal documents, although they don't always have to be. And the most typical examples are the durable power of attorney for healthcare and the healthcare directive. I will go into that more in just a little bit. The healthcare directive is called a living will. The durable power of attorney for healthcare is where you name that healthcare agent, that person who would make decisions for you. You'll see as part of this is also POLST. It used to be called Physician's Order for Life-Sustaining Treatment. Now it's called Portable Order for Life-Sustaining Treatment. That's because it travels with you. We'll talk more about that in a little bit too, but it's also part of this whole advanced care planning process. As I said, it's not a legal requirement to do any of these documents. They're all voluntary. I think that's really important because sometimes we forget that they are voluntary. What you need to know is to make them a complete document. We'll talk about that to make them legal or binding. We'll talk about what you need, but it's usually witnesses or notaries, definitely signatures. And we'll go into that more detail about that in just a little bit. All right. So how planning can help us later? And by later, I mean towards the end of life. Well, I'm not going to go over every single statistic here. You can look at them, you can read them, you can reflect them. But I will say this. There is this huge disconnect between the desire of wanting to talk about it. People actually really do want to talk about it and actually doing it. You can see how big of a gap that is. And if it's hard to have a conversation, it's just as hard, maybe even harder, to write it down. So remember that if you are writing your documents, it's okay if it takes you time. It is okay. And if we don't have these conversations, if we don't write something down, then there's this big gap between what people really want. Most people want to die at home, and what people actually, where they actually end up dying. Excuse me. Usually in a long-term care facility or hospital. And as I said earlier, excuse me, it may not always be possible to have that opportunity to die at home, but if that's what you want, let's get you as close to there as we possibly can. I'm going to take a quick sip. I get so excited that all the words get stuck in my mouth, in my throat. That's what this is. All right. So if it's important for the individual, it's really also important for everyone who matters to them. There are aftershocks of death, and they can really impact the surviving loved ones. So, there's more likely to be longer grief. There's more likely to be PTSD. And what it comes down to is, I say, we really want people, we're not going to be able to get rid of grief. That's not going to happen. People are going to grieve. People are going to be sad. That's a normal process. But what we really want to do is make sure that people are grieving the person and not the decisions that they made, if they had to make any. So it's really important to think of this as not only a gift to yourself, this is what I want, this is how I want to be, but also to those who matter to you, so that they can feel assured that they're channeling the decisions that you would actually make. All right. But I'm going to tell you a little secret. Planning can help us right now, right in the now. And I'm not just talking COVID, I am talking about how we live, in addition to helping with the end of life care. So, as I said, advanced care planning is about how you want to live, not how you want to die. So when we plan, when we spend time to actually reflect on what's important to us and what we hold dear and what values we have, and then we think about how that might look like in medical decisions, what that means is that even as we make medical decisions right now, we can apply that same self-introspection and knowledge to those decisions, right? So we can create maybe a stronger bond with our provider. We might get health literacy and understanding out of this. We will be able to activate our medical care based on the needs that we've identified. And I'm going to give you 2 examples, maybe 2.5. So the first one is me. Like someone said with the joy, I love hiking. I love being out amongst the trees. I like just the way it feels to just go romping around and just sort of experiencing nature. I love hiking a lot. And I am allergic to just about every single tree that's out there. So you can see that this causes friction in my life. But I have a great allergist and I take allergy medicines, and that makes it so that I can go and do something I love, which is hiking. Now, imagine if my allergist came to me and said, "Hey, Bonnie, I'm so excited. There has been a new drug development and I cannot wait for you to try it. I think it targets the tree allergies. It's going to make your life so much easier. You're not going to get as congested. Everything's going to be great." And I can say, "Oh, that sounds fantastic. Tell me more. What do I need to know about it? How will it impact me?" "Well, it'll do X, Y, and Z. Here's a couple of side effects though," because I always like to know side effects. If he said, "Well, it does come with sun sensitivity. So you're not going to be able to be out in the sun for more than a couple hours at a time. That can be problematic if I'm, hiking along the beach or even in the forest. So I might be like, that doesn't sound too promising for me. It's important that I hike for a while in the sun, and I don't want to be too concerned about what's going to happen. Or maybe he says, the only side effect is people are quite a bit more lethargic. Their get up and go kind of has got up and gone. I'll be honest, it takes a lot of effort to get me out of bed because I love bed. So more of that, it's not going to help me get up, out, and into the forest and into hiking. So in that case, it wouldn't really fit how I like to live, but I wouldn't have known that without knowing what's important to me in planning. I'll now give you a famous example. So Dr. Jennifer Brokaw is the daughter of Tom Brokaw, the newsman, the one, rah, 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 that guy. So she was talking to us, and there's a great TED Talk where she sits down with her dad, and they're going to talk about end of life. And he's basically, everything I want. You have all the documents. And she's like, I don't know what you're talking about, Dad. Don't have any documents. Don't know what you want. Typical child parent sort of, or, typical conversation, just period. And so after that TED Talk, they sat down and they really went through and thought about what was important to him, identified his values and preferences, and wrote them down in an advance directive. And then about 3 years later, Tom Brokaw was diagnosed with cancer. And Jennifer Brokaw, who had been an ER doctor by training and started her own business specifically around end-of-life care, said, the first thing we did was we went back to that document and we made sure it still made sense for him. Like the values and preferences, were they still the same values and preferences? And once we did that, then when we went into treatment, we knew what was important to him, so we could select the treatment that would best fit his values and preferences and goals. And I have to say, from my own personal experience, that is true. My mother had a second bout of non-Hodgkin's lymphoma, and, she had developed this ritual where she would have one glass of pink champagne every day. That was her daily, brings her joy. And, it was really important that she be able to continue that. That was non-negotiable, or so we thought. And we went in and we talked to the doctor and said, this is what's really important in her life. And it became clear that if she wanted treatment, she would have to give up alcohol. So she thought about it and she actually said, you know what? I can give up alcohol, but the goal is still that I can get back to where I'm drinking a glass of pink champagne every day. And guess what? She got through it. Guess what she has every day? Glass of pink champagne. Or sometimes she'll switch to just Scotch whiskey, but that's my mom for you. So that's how it could actually help us now. If we plan now, this is the practical application before we're even near end of life. So let's move on to what are the legal documents to use. Those are the advanced directives. And then you'll see the POLST on the right. And I have to apologize. I neglected to switch out the image. And so it still says physician orders. It really should say portable orders. It has a beautiful little symbol that looks like arrows going around. So just know that image is incorrect, but just for some minor things. So the legal documents to use, and I'm going to go from left to right on the screen. The first is the durable power of attorney for healthcare. That's where you name your healthcare agent. That's the person who would speak on behalf of you if you're not able to make decisions for yourself. The middle document is a healthcare directive. A lot of people call that the living will. That's where you make very specific treatment decisions, usually around nutrition and hydration, and a very specific circumstance. terminal condition, permanent unconscious condition, very specific. And then smaller to this side, because it's not a legal document, it's a medical order. I will talk about this in a little bit, is that portable order for life-sustaining treatment. What I want you to understand is there is a huge difference, not only between the two on the left and the green document, besides just legal and medical. There's also a difference in when they're used. So the durable power of attorney for healthcare and the healthcare directive, they're really about future decision making. If I'm in this situation, what if, the very future, right? So looking down on that horizon, the portable orders for life-sustaining treatment is really about what's happening now, what is happening now. And so if the other two are the horizon and the portable order is down on the ground, you're either in the dirt or you're in the water. So it's really the difference between future healthcare and current healthcare. And so I know a lot of people say, well, how does this work together? And so let me explain to you how it works together. So for example, say someone has a POLST and it's where people can see it. And it's something that EMRs, the emergency personnel, can use. If say they go to someone's house because they got a call and they see that POLST, they will do what the POLST tells them, because for those EMTs, those technicians, it is a medical order. It's like having a doctor telling them what to do, standing them right there, telling them what to do. And then they take that green, it's usually bright green, although it doesn't have to be legal, to be followable, I should say. They take it and then they might rush that individual to the ER. And in the ER folks will know about the POLST, and they might start looking to see if there's also an advance directive, whether it's the naming healthcare agent or the living well. And they'll act as they see fit. And then if that person then is checked into the hospital for more longer term care, that's really when that advanced care planning, those advanced directive documents take place. And then say that person then goes to a facility, like a rehab facility. The POLST, again, still follows. The POLST is just traveling with them. It's just traveling with them like a penny, and goes with them. And then it goes more back to the POLST. So that's just one sort of general ways to see how they interact, because I know a lot of people get confused about how they may work together. And just so you know, we encourage anyone who's 18 and older to do an advanced directive. We'll talk about who should do a POLST in just a little bit. And another gentle reminder, again, all of these documents you're looking at, they're voluntary. So let's go into the durable power of attorney for healthcare. The durable power of attorney for healthcare is a great place because you can name the individual who is going to make those decisions for you if you cannot make them yourself. But a lot of documents, including ours at Honoring Choices Pacific Northwest, has a section where you can describe personal values and goals for treatment. So you can really, this is the document that I say, just let your voice shine through, color outside the lines, say what needs to be said. And if you run out of room, get another piece of paper and keep writing. Because this really is the document that it should be. It's not as long as if you wrote an autobiography, but it's really where you capture the true essence and the vital essence of yourself and what's important to you. And when you name that healthcare agent, we always suggest that you get a couple of backups. And the reason is because usually people choose someone who they're close to be their primary healthcare agent. And if something happens to both of you, then it's always nice to have a second and third on deck just in case. Regardless, you're going to want to talk to everyone, make copies of this document, share it with those definitely who are healthcare agents, but also your providers, maybe loved ones, My parents aren't listed as my healthcare agents. There's other people. And I still have shared that with them because they're still alive. And I want to make sure that they know what's important to me and how they might be able to help. This document can either be witnessed or notarized. You don't have to do both. You can, but there's no need to. So that is the durable power of attorney for healthcare. So why would you also want to name an agent? Well, I got some news for you. If you don't name one, don't worry. It's already been done for you. It's already decided. And what I would suggest is you really look at that list and that image that's right there. You may be okay with, for example, your spouse or your registered domestic partner being the person making the decisions. That may be okay. But like I said, if something happens to both of you, then they're going to go to the adult children. Or your parents, and that may not be okay. And something else to know is that if there's more than one person in a group, like adult children, parents, siblings, grandchildren, whatever, all of these people have to agree on the treatment, all of them. I have a lovely, lovely brother in Texas. We love each other deeply. We see eye to eye on just about everything, but we don't see eye to eye on everything. So it really is important to talk about those wishes, even if they're not named, so that they can understand. And if you're wondering, well, okay, who should I choose? I got a list for you. I got a list for you right here. You want the person to first say yes to that role. So that means you're actually talking to them before you even name them to say, hey, I want to name someone. I think you'd be good. Don't worry. I'm going to prepare you for it. I find that helpful because sometimes people are like, no. And then because they think they're just going to leave them to it. And they want to make sure they're doing good by you. So make sure that they agree to the role and then talk. They have to talk to you about your goals, values, and preferences. They have to be willing to listen. They have to be willing to follow your decisions, even if they don't agree. My husband has some decisions that I'm not 100% with, but that doesn't mean I can't do them for him. Because when I talk, if something happens and I have to take that role on, it's not about me. It's all about him. That'll be a change. I'm just kidding. All right. And then finally, that person needs to be able to make decisions in difficult moments. Frequently, when people are asked to make these decisions, it's in a crisis situation. So they need to be able to do that. And often you'll look at the role and someone may hit 3 out of 4, but not all 4. And if you think you can get to that 4th, great. If not, maybe they shouldn't be that healthcare agent, or maybe they could be a 2nd or 3rd. One of the questions I use to help me figure out things like this is, in times of trouble, who do I turn to and trust the most? If I have a question and I really need guidance, who do I go to? Because that's usually someone that you trust, and it's likely someone who cares about you deeply. Okay, so I'm going to switch now to the living will. So what is a living will? Well, as I said, it's an opportunity, it's a legal document to select specific treatment, whether you want life-sustaining treatments, nutrition and hydration, in very specific situations. So what I like about the durable power of attorney for healthcare is that it's really about the gray area. Someone gets to know you well enough that they, no matter what happens, can make those decisions. This is not quite as much. It's more of a black and white sort of scenario. And, there's those specific conditions, terminal condition, permanent unconscious, number of physicians have to say so, or I think it's 2. Like the durable power of attorney for healthcare, it has to be witnessed or notarized. You don't have to do both. You just have to do witnessed or notarized. I will say that if you are doing both documents and you are doing witnesses, please make sure you pay attention to the witness requirements. who can sign, who can witness for the durable power of attorney for healthcare is slightly different than who can sign or who can witness for the healthcare directive. I suggest if you're going to do both, go with a notary. Most of them charge a nominal fee, but they can do that for both documents, and you don't have to worry about making sure that all the I's are dotted and T's are crossed for the witnesses. So I just like to make sure that people know that. And FYI, if you download these documents or use the Honoring Choices Pacific Northwest version, we outline on each document who's permitted to be the witnesses. Yes, Beverly, I bet you have a question. And while you do, I'm going to take a sip of water.
Well, I was just going to say that one of the multitude of benefits of a PMA membership is you can get access to free notary services. So if you do decide you want that, I happen to be a Washington State notary, and I have a couple of colleagues here in the office who are as well. So if you do need some help, reach out to us, and I'll make sure you have that contact information, because it can be tricky to track someone down and do it socially distanced and safely.
Yep. And I'm a notary too, and I don't do it that often. And so I bet it's better with Beverly and all. I bet they do it more often. I look at it and like, okay, do I remember what I'm supposed to do here? I mean, I always prep and I always review, but when you want to do well for someone, sometimes you just go, ah. But anyway, great resource. I'm so glad to know that. I'm now going to send everyone to you. So, all right. Okay. So I am going to go on to tell you how you can best communicate your wishes in those documents. The most important thing is be clear, be clear, be clear. Be as clear as you possibly can. And that includes capturing that key information. That includes if there's sections that don't apply to you that you don't want to fill out, cross them out, or write not applicable. So people who are looking at the document in the future know that you didn't accidentally just skip that section. Cross out those unwanted words, phrases, etc. I think that's really important to do to make sure that it's very clear what you prefer. You can do that easier on the Durable Power of Attorney for Healthcare form than you can on the Healthcare Directive typically. Know those different document requirements, talk to providers and anyone else who matter, and be patient. Be patient with yourself. Be patient with others. Be patient with yourself. I'll tell you a little secret. I got this job and it took me over a year before I could actually put pen to paper. And then I had to do several drafts. So it's okay if it doesn't come out exactly how you want it the first time through. And then once you've got that written out and you've figured all that, be patient as you talk to other people. You've had plenty of time to sit back and think about it and come to sort of a peace with it. And sometimes people will be like, no, I don't want to talk about this. Well, that doesn't mean you give up. That just means you keep saying, this is really important to me. I would like to talk to you about it sometime. Can we schedule a time so that I'm not asking you to talk? I'm not asking you to ask questions or do anything, but even if we just do a little bit at a time, that's good. It doesn't have to be done in one conversation. It doesn't have to be done in one sitting, but I promise you, the more you do it, the more you practice it, the easier it becomes. It has become so easy for me that now if I get a head cold, I'm telling my husband exactly what I want. I'm like, you remember what I want? I want X, Y, and Z, A, B, and C, even if it's just allergies. So it becomes a lot easier. I promise you. I promise you. All right. Okay. So the last little document I want to cover real quickly is it still says physician orders. I am so sorry. They just changed that not too long ago. So I apologize. It is portable orders for life-sustaining treatment. Portable, portable, portable. Why? Because it's portable. And what you need to know about this document, besides the fact that it is voluntary, is that it really is for the seriously ill or medically frail. So you could have a really healthy 70-year-old who doesn't need a POLST. And you might have a teenager who has a serious condition who does need a POLST. And it's about specific medical procedures, CPR, other interventions like ventilation. It has to be done in conjunction with a provider, a doctor, an ARNP, a PA. It has to be signed by the patient or the legal representative of that patient. It should not be something that you just get, like a doctor hands to you and says, go fill this out. You really need to talk to someone, talk to your provider about the different choices. And honestly, you really should do your advance directive, whether that's the healthcare agent, naming that healthcare agent, or that living will. You really should do one or either or both of those before you do a POLST, because you really want to come to a POLST knowing what your values and preferences are. Sometimes people do start with the POLST and then go backwards, and that's okay, but it's built to come after the advanced directive. And like the advanced directives, it should reflect your values and your preferences and your goals of care. And I've told you when it's usually applied. So, you have to just talk about it with your provider. Now, sometimes people will use this form if they specifically don't want things to be done by EMTs in their home. Like if you're carrying this around and something happens, people are not going to hunt for it necessarily. There's a lot of good pedestrians out there, good people out there who are trained in CPR. And so if, for example, you didn't want CPR, they're not going to know that. But if you don't want something, you can talk to your provider about really not wanting something done if, for example, EMT is called to your home. So it looks like we might have a question in the Q&A. I just want to let you know before I get to the Q&A that you can find us at honoringchoicespnw.org. You can email us at info@honoringchoices. That website also has a contact form so that if you want to book something, you can. Prepare for Your Care is a great place for resources. They have videos and the Conversation Project. And it says, join us for Celebrate NHDD. I am so sorry. I did not realize that this was just like way back yonder. You can still go to that website. There's still a lot of really great resources that you can use. But just so you know, if you go to our website or honoringchoicespnw.org, and you go to events, we have monthly webinars where we even talk through the specific documents, something that looks like this, or you can just reach out to me personally. I'll make sure that my information is shared via Beverly, and you can reach out to me and I will be happy to help. So, and follow us on social media. We have awesome social media. I'm not just saying that because I'm the one running it. Today, I actually used a tweet by Dionne Warwick. Yes, I did. So, I feel really important. So yes. Okay, let's get to the question. So let's do Q&A, and so make sure that people get the information they really want.
Okay, wonderful. Thank you so much, Bonnie. That's an embarrassment of riches in terms of information. And I want to give folks,
it's a lot. So I don't expect people to walk away knowing everything. It's okay.
Yeah. No, if you're feeling overwhelmed, that's because there's a lot to take care of, and we're going to make sure you have the resources to get started on that journey. Please feel free to drop your questions into the chat box or use the Q&A feature again. And while we wait for folks to do that, I'm going to start you off with a couple questions.
Okay.
So we do have someone who's curious, how do you pick a healthcare agent or the person that is your durable power of attorney if you don't have like a really close friend or a family member that you're comfortable with functioning in that role? How do you find someone to do that?
So there are professional people who do this. And one resource, if you can hire them, so they're professional people, you would have to pay them. I want to make sure that's clear. It is at healthadvocatex.org. They have a find a health advocate, and you can look, and if they say healthcare proxy next to their name, they will do it for a fee. They don't have to be a family member. They don't even have to be a friend. They just have to be willing to fit those four things. So, it can seem like a lot to ask of someone. And And, I know there are people who may not have people. And if they don't have funds, I really suggest that, maybe find someone who might be in your similar situation. Maybe, you are part of a video gaming group, and though you don't know people, you really like the way Thina, or whatever her name is, plays, or their name is, plays the game. And maybe just start a dialogue with that person if you have a friendly relationship. And I know that might be asking a lot. The other thing you can do, if there's truly nobody, you can still complete those forms. You can still write down in the durable power of attorney form what is most important to you. And you can even have it notarized. You can still treat it as a legal document and cross out that section. There's actually a box on ours that says, I prefer not to name anyone. And still share it with those people who provide care for you, because then you still have that legal document. And even if you don't want a legal document, you can still write out what's important to you and share it with those who might be providing care. It will not direct your care if it's not a legal document, but it can guide your care. And I'm here to tell you, if people are in that situation, if a provider's in that situation, they're going to look for anything they can to help them make the best decision for that person. Not the right decision, the best decision for that person. I hope that helps.
Yeah, no, that's very helpful. I know I met with a couple of folks a few years back, and there's these two sweet little old ladies, and they just so happened to be living next door to each other in a care facility, and they both outlived their entire families. And so they said, hey, I'll be your healthcare agent if you'll be mine. And it ended up becoming a beautiful friendship between them. I have a follow-up question for you about that. Are there any limits on who you can choose? Like, does it matter if they live out of state, or what their relationship to you is? Or are there any limitations?
No. So you can choose people out of state. You can choose people out of country. They don't have to be blood. I know for a lot of people, none of the people I chose are blood. I mean, I'm married to one of them, but we're not blood relation. They don't have to be family. They don't even have to be, they just don't. What I will say is, if you choose someone who is out of state or out of country, I highly recommend that you have backups that are closer. And here's why. It may take a while to get, if someone's in Spain, the time difference, it may take a while for them to get in contact. And in the meantime, it's very nice to have someone who can make those decisions to sort of be that placeholder for you. But again, you need to talk to them about it. So I'll tell you how I used my second and third. I listed my husband as first, and I said to the second and thirds, when I shared the document and talked to them, I said, if my husband's the one making decisions, you don't have to do anything except tell him he's making the right decision. I don't care what the decision is. You just tell him he's making the right decision. If you have to make decisions, then this is my preference. So you can also craft how that role looks for them to a certain extent. I hope that helps.
I imagine that's very helpful for lots of folks. I did have a couple of folks saying they're having trouble hearing me, so I turned my microphone way up.
Okay.
Let's see. Well, I know one thing is, one of the things that I love about the forms that Honoring Choices offer is that it's super specific, but it can be sometimes a little bit daunting if you're just starting your journey to determine your wishes, to sit and think like, how do I feel about feeding tubes or ventilators or all of these specific things? So is there an option for folks that how they can document their wishes if they haven't decided on the specifics, or maybe they're not comfortable with the forms that they're kind of working on?
Yeah. So I'm going to tell you right now, the most important thing is to talk to people who matter in your life about it. That's the most important thing. That is the most important thing. Then if you want to do a document, great. So if it can be daunting to think about CPR and ventilation and all this stuff. So, work your way up to it. So ask yourself, just start thinking about things that are important to you. What brings you joy? I love that. Sit down, write a list. Write a list of what brings you joy and what does that look like in your life? How do you live that? How do you live that? That tells you what's important to you. Or maybe you're not living it fully that way anyway, but like, that's okay. Who do you turn to and trust? That helps you start figuring out who might be a great healthcare agent for you. I love to ask, so if you were going to be famous for anything, what would you be famous for? And why? Because that tells me something about what people are hopefully proud about. And so that, again, gets to that sort of, what is that quality of life? So start small. Just start small. Ask yourself these little questions. So there's also some great games out there. If you want to play a game, there's the Death Deck. Look at that. They have great questions. Some of them are multiple choice, so you don't have to come up with something out of the void. And some of them are fill in the blank, and some of them are open-ended. And you can play that with other people, or you can, like I do, I just pick a card a day. What am I going to think about today? Okay. There's also the Hello game. And if you go to that Celebrate NHDD, there was a personal challenge, and it has 5 questions that you can just start thinking about. So Beverly, did you want to add something?
Oh, I was just listening. I love these tools. I just started using the Death Deck with my partner over the weekend, and it brought up some conversations we've never even considered. It's a wonderful tool.
And if you don't want to invest money, we have a free game that you can, if you type in Honoring Choices Pacific Northwest foolproof, like I'm not a fool, I'm foolproofed, right? You should be able to pull up that game. I can make sure Beverly has that link too. And it has 10 questions, just 10 questions to get you started. And you can either play it with someone, or you can just, use it for yourself. So, and if you don't want to write it down, just pull out your phone and just record your answer. Start where you're comfortable.
It's a great option. Once people have finally tackled this project and they've considered their mortality and all of its facets, what do they do with all that paperwork? Like, where do they keep it?
I know. Paperwork. So you want to keep a copy keep the original for yourself and put it someplace that people can find it. It doesn't need to be in a safe. Do not put it in a safe. My ex-stepmother, yes, I have ex-stepmothers, step-parents, actually has a binder that is like on this bookshelf, or when you walk in her door and there's a bookshelf and there's her like binder of important stuff. And everyone knows that. And so it's in there. Just make sure it's someplace that somebody could find it. And if you can, then make copies and share it around. Make copies, especially for those healthcare agents. So they have a copy so that if they show up to the hospital or whatever, they can say, here's a copy of it. If copying, because copying can cost money, our form is downloadable. You can download it, you can type in it, you could save it as a PDF, and you could just send that virtual version if you wanted to. Especially handy if that person's in Spain, right? So that's what you need to do. What you also need to remember is if you change your mind and that mind change impacts what's in your document, you need to change that document. And the most recent document will be the document that they look at. So you want to make sure that you keep a list or keep a mental list of who you gave the documents to. So if you change your mind and you change your document, you can share it with everyone. Now, if you change your mind and you can't write it down or don't have time and something happens, that's okay, as long as you've been talking to people about it, because they're going to be able to say, no, we just had this conversation a month ago, blah, blah, blah. So, yeah. What else? Bring it on. I'm having fun.
Yeah,
I know
that's so many good ones, but I think we have kind of a shy group here. I don't know. It looks like we worked through all the questions that folks have. But that's okay. Sometimes it takes a while to chew on all this information. It's a lot. So if you do think of something a bit later, please feel free to reach out to us. I'll be sending a follow-up email to this presentation with a recording of Bonnie's presentation. Maybe she'll even let us have a copy of her slides to cheat off of.
Yep.
And we'll make sure you have contact information for both of us. So if something does occur to you and you need some help with some resources, or you're looking to get this death concierge, end-of-life concierge, as Bonnie self-identified.
Advanced care planning concierge. I've trained as a death doula, but not completely. So
Bonnie's going to update her LinkedIn with that new title. But thank you all so much for joining us. I know this isn't something that most folks really want to spend their time talking about, but these decisions are so important, and it can be such a beautiful gift to the people that love you to help them make these hard choices when you're not able to communicate about your needs. So thank you so much for joining us today. Thank you to Bonnie for sharing all of this information, this expertise. Yeah, thank you to everyone. It's been wonderful learning so much good stuff.
Always have fun doing this. I hope people see that. I'm probably the most happy person talking about advanced care planning.
That's
I know that you and I will stay on for a little bit, but people should feel free dropping off, I think, if they want to.
We're gonna go ahead and close out for today. And thank you again for showing up and hanging out and learning. We appreciate all of you so much. Have a good evening. And then I'll have you stick around just for a second.